I'm Evgenia Galinskaya, a dermatologist turned career coach for those doctors who would like to move away from direct patient care and launch non-clinical careers with confidence. My special guest today is Dr. Anthony Huszar. Anthony and I studied medicine together at Cambridge, and he now works in global health security at Mott MacDonald, which is a global engineering and management and development consultancy. And Anthony has kindly agreed to help us understand what are the various options in public health that could be interesting and relevant for physicians, and how physicians can break into this field. This is going to be a very informal conversation, and there won't be a very serious webinar or PowerPoint presentation. So please feel free to ask your questions, post your comments, and we will attempt to answer them during this 30 to 40 minute live stream. There will also be a recording that I will post on my YouTube channel for those of you who cannot stay for the whole duration. So I'm going to now bring in Anthony Huszar. Hi, Anthony. How are you?
Hi, Zhenya. Yeah, very good. Thank you. Great to be here. How are you doing?
Yes, I'm very well as well. It's really hot here in London. We are both in London, by the way, so I know that we will have quite an international audience from all over the world. So it's great that there is so much interest in public health. And I know you've been in this field for around 10 years. So it would be really good to understand, first of all, how you planned this career, if you planned it, and whether you knew back in medical school that this is what you want to do.
Good questions. It certainly wasn't planned. I think before medical school, I kind of grew up thinking I always wanted to be a doctor. I loved the sciences. I wanted to help people. I thought medicine would let me travel the world. And so I kind of went through medical school just thinking I was going to become a doctor. And then over the years, finishing medical school, working as a doctor for a few years, I started to sort of lose interest and sort of my drive to go to work and do what most doctors do. And at that point, I started looking around for alternative careers, I guess.
Okay, and did you know that public health is something that is possible for a clinician straight out of clinical practice?
No, not totally. I mean, I knew what public health was, and we had a few modules at university, did a couple of option modules on it. So I knew it existed, but it certainly wasn't a mainstream subject as part of anyone's medical training, I don't think. Yes. So when I started to explore what was out there, I think that was when I started to realize that there was a whole world of healthcare that was outside the clinical setting. Initially, it started with me just attending a couple of conferences locally, just in the local health catchment area with what was a PCT at the time. I don't know what they're called anymore in the UK, but started to chat to people, started to find out how people worked overseas as doctors, and started to look at lots of different things. It's probably worth adding, when I first left medicine, I didn't go straight into public health. I was a little bit lost and sort of applied for a few jobs here and there. And the first thing that came up, which I took, was to be a sort of volunteer project manager / expedition doctor for a charity, based a British charity, but the project was based in India. So I took that.
When you say the first project that came up, did it just jump at you, or did you apply? Did you actively seek out opportunities? This is actually really important, because many doctors out there think that how do we actually create these opportunities?
Sure. No, I mean, I did apply for it, but I applied for a few different things. I can't remember all the things I applied for anymore, but there certainly wasn't too much. There wasn't too much planning. I applied for lots of different things and just kind of saw what came up. And this one looked like it was interesting. It was fun. It was a little bit clinical, so I had the right skill set for it. And it was only for a few months, so it kind of gave me the options to sort of just get myself out of formal training, out of the UK system, see, to help me spend some time thinking about what I wanted to do with my life.
Okay, so you didn't have a whole kind of career lined up in front of you. You just wanted to see what could be the next step.
Yeah, exactly. And public health was something I kind of knew about. The work in India, although it was an expedition medicine, youth development type charity, some of the projects were related to public health. Mm-hmm. And so I kind of had that in the back of my mind to say, well, I could always learn something from this and use it for whatever the next opportunity might be. So yeah, when I took the job, I certainly didn't have a long-term plan. It was really just to take a break from the day-to-day grind of working in a hospital in the UK, take some time out to think, reflect, meet some different people, meet some people who aren't doctors or clinicians, and see where I ended up. So at the end of that opportunity, I applied to do a diploma in tropical medicine. So that was back to the clinical stuff in the UK. But again, I was a bit confused. I was a bit lost. I didn't know where to go next. It was, again, 3 or 4 months or so in London School of Hygiene and Tropical Medicine, a chance to network, a chance to see what else was out there. And although it was a clinical program, predominantly geared towards doctors, as you can imagine with tropical medicine, it gave me a bit more exposure to public health.
Yes.
And I think it was during that period that I thought, actually, public health is pretty interesting. And it's related to healthcare. There's problem solving. There are opportunities to travel. It's pretty interesting. There's a lot out there in the world. And it was at that point that I really started to transition out of clinical medicine, I think.
Okay. So you are now in global health security. How did you decide to get into this field, or was it sort of serendipity? How does it work in public health? Are there set career tracks for doctors?
So there can be. I think some people go into public health knowing exactly what branch of public health they want to do, what they're interested in. And in the UK, there's a public health training program you can do. But it certainly doesn't need to be that way. Certainly in my case, it wasn't that way. Yeah. I just followed my nose, did things that were interesting to me, took the opportunities that came up. Certainly when I made a decision to go into public health, I didn't exactly know where I'd end up. It might be helpful at this point to sort of just recap on some of the decision points that I went through. So after finishing the diploma in tropical medicine, I applied for a few jobs and opportunities, and something came up in Thailand through the London School of Hygiene and Tropical Medicine, again, just through networking in that field. And they were looking for a clinician who could support a public health program. So to me, that sounded perfect. That was my skill set, but gave me more exposure to the stuff that I thought I was interested in. So I was working with health economists, I was working with disease modelers, working with policy experts, and my contribution was, at the time we didn't know what it would be, but it was sort of helping them understand how a doctor might think in a hospital setting to help them track out what the options were for the modeling, et cetera, I did that for about, I can't remember exactly how long, but not long, maybe 6 months or so.
So you moved to Thailand for that?
So I moved to Thailand. It was paid, or at least I had my costs paid for and a stipend. So I didn't lose any money, but I didn't make a lot of money either. Yeah. But again, this was sort of this was all within my unofficial gap year, I guess. All the opportunities I took, the India one and this one were, they were covered. So I didn't have any outgoings. But again, I didn't make as much money as I did when I was a doctor. But this was sort of part of my plan as well, to take a year out, see what was out there, try a few different things. And it was that experience in Thailand that made me realize, actually, for a career in public health, I probably didn't have the right qualifications. So working with these other experts, I realized that public health, it's about big picture. There's lots of different branches. There's policy, there's health economics, there's financing. If you're interested in sort of disease patterns and trends, there's epidemiology, demography, modeling, biostatistics. There's health promotion, health education, health communications. There's the administration side of planning, that kind of, that side of public health as well. So it made me realize that actually I had the clinical background and I'd been exposed to a few things, but actually if I wanted to take this seriously, I needed a few more qualifications. So at that point I went back to university, studied a master's, and I don't know who's on the call, but if anyone's from the US, I think it's usually 2 years to do an MPH in the US, but in the UK it's only a year. And actually the second half of your master's in the UK, you're actually doing your project. So you're only really studying for 6, 7, 8 months.
Okay.
So it wasn't that long, and I was a bit reluctant at first because you've already gone through medical school, you've spent all these years studying, you're behind your friends.
Yeah.
But in hindsight, it was the best decision I made to go back and study. It gave me skills that made me marketable in public health. Mm-hmm. And then you couple that with the medicine. It gave me so many networking opportunities, and it helped me understand what opportunities were out there. So certainly as a clinician, and even in my sort of gap year, I didn't realize that public health didn't just mean working for the government, sitting in an office in the UK.
That's what I always thought of as public health. Yes. Yeah.
Yeah. So there's lots of different types of public health, and you realize when you do the masters that there's all these different companies, all these different organizations doing public health work. There's all the domestic work, UK based, or I'm not sure where our viewers are from, but I'm sure in each of their countries there's going to be some kind of public health service through the ministry, through some public health agency, think tanks, universities, etc. But there's all the stuff internationally as well. So you've got the charities, the NGOs, non-governmental organisations. You've got the aid programs. You've got the philanthropic trusts, just Bill and Melinda Gates Foundation, for example, that kind of thing. You've got startups working in tech. You've got UN agencies, like the World Health Organization. There's all these different types of work that you can do, and within each stream of work, they're slightly different. And there's lots of organizations that work in those areas.
And how would a doctor actually go about understanding these different streams? Is there a resource that they can read, or is it mainly through that networking and the master's degree that you managed to understand where all these different departments and organizations sit?
Yeah. A bit of both. I mean, I'm sure it's up there on the internet somewhere, but I certainly didn't find it until I did my master's program and started to understand the landscape. And even now, I'm learning about new organisations doing different types of work in public health internationally. The most useful thing to me that I probably want to share with the audience is the networking side. I know it's not for everyone; it's not always the easiest, but it's easy to have an idea that you want to do something. And I was very much in this position as well, but you don't really know where to start. And it's only when you sort of start to throw yourself into situations and chat to people that you realize there's this whole world out there.
Can you give an example of so networking, I think for different people means different things. And there's a lot of misunderstanding, especially amongst doctors, about networking. So how exactly would one go about doing this? Would you just approach random people on LinkedIn, or in this day and age, currently it's difficult to go to live conferences. I guess it would be easier to approach somebody like a speaker at a conference, and maybe that's how you did it. But right now, for the next few months, if somebody did want to take your advice and network their way into this, how exactly would they do that?
Good question. And I think everyone has a slightly different approach. I don't think there's no blueprint or standard operating procedure. It's not like medicine where you follow the instructions. Okay. My approach is to kind of hit it from different angles. So sent a few messages on LinkedIn if I stumbled across an interesting profile.
What would you say? What would you say in the message?
Yeah, so this is going back a little bit, but at that point, when I was sort of starting my exploration into public health and global health, I would generally just say, I just saw your profile, it looks very interesting. Would you be available to have a chat, or if they were local, a coffee, to share your career story and how you got to where you were?
Okay. And were they receptive?
I found people.
Did you
so I find people.
Responses?
You don't always get a reply, but you only have to get lucky a few times to generate a few conversations, and they might lead to other conversations, etc., etc. So don't be disheartened if people don't reply. People are busy, but someone will reply if you send enough messages out. And the secret of networking and finding jobs and stuff is you only need one job, so you only need to get lucky once. So put out the messages, see what comes back. And certainly I found if you don't ask people for jobs outright and you say, I'm interested in you and how you got to where you are, people are much more willing to talk about themselves and their career stories and that kind of stuff. And obviously it depends. I mean, now it's a bit difficult with social distancing, but if you're able to meet them for a coffee, I found that's a great way. You can really show your interest and show your commitment to finding out more. And if they say something or they mention an opportunity that sounds interesting, find out how they got that job and who they expected to get that job, and whether there's a person there who might be willing to talk to you as well. And you never know. Eventually, one of them will turn into a job. That's all you need.
Right.
So there's that side on LinkedIn, and then there's the conferences. I guess you can't go to too many conferences because it takes time and they're not cheap and not free. But I mean, don't tell my boss this. But when I go to conferences, I'm usually not there to listen to the speakers, because a lot of that information you can find online anyway. It's about the people you meet in between the presentations. If a speaker says something interesting, it's the follow-up conversation when you find them in the coffee break. That's really valuable. And sharing business cards, finding them on LinkedIn. There's that side of it too. And then it's just sort of, just getting out there. And you'll be surprised how many people, once you start chatting to a few people, you'll be surprised how that snowballs into more and more discussions, until eventually someone might offer you an opportunity.
Okay.
So, yeah.
and I think it would be really helpful if you as an expert could help me and the viewers to understand the differences, if there are any differences between public health, global health, international health, because I certainly use it interchangeably. Am I being wrong using this interchangeably?
There's definitely overlaps. If you're familiar with Venn diagrams, I think this is a good example of where a Venn diagram would come in handy. I think you've got three overlapping terms. The first one to tackle is probably public health, because I think that's the most clear cut. So public health is essentially the study of health at the population level, and it's got lots of different subspecialties, I guess. You've got generalists, but you've also got people who specialize in epidemiology and health policy, financing, health communications, that kind of stuff. But that doesn't have to be overseas. That can be in your own country. So you don't have to leave anywhere to do public health. You can also do public health overseas. And that's where you start to stray into global health and international health. So I think public health is a clearer definition. Global health and international health, I think, if you go online and Google it, I'm sure you'll find lots of different definitions and lots of people arguing and debating about whether they are the same or different. I think there is more overlap between the two. To me, they're a little bit different, but I appreciate not everyone would use the same definition. So to me, global health is something that spans, that crosses boundaries and affects all people. So, things like COVID-19, things like Zika virus, things that the international health regulations or the global health security agenda are based on. So disease surveillance, potentially even things like obesity, or things that affect everyone and crosses borders, transboundary diseases, that kind of stuff. That's global health, and that often involves public health specialists, but it can also involve clinicians too. So, you've got laboratory experts, microbiologists, for example, clinical microbiologists. They're not public health people per se. They're often clinicians or lab people, but they work on a global health problem. And you've got global health security people in the UK, in the Department of Health, for example. Although they're working in a global health team, their role is very much about protecting the UK from other diseases coming in, organising the borders in a way that allows to pick up new threats, etc., etc. And also not just infectious diseases, but radiation and other types of things that might threaten us, for example. International health This one's is probably the most tenuous of all the definitions, but is often used, I'd say, in the aid environment. So it's about bilateral aid. So it's where one country supports another country in some health field. Again, it can be a public health person, but it can also be a clinician. So it could be some research that the UK-based clinical researcher is doing in a different country. It could be teaching, training, virtual training, e-health type stuff. It could be the kind of work that I do, public health work as well. So the three terms to me are a little bit different. I would say I probably work in all three of them,
yes.
Which is why, in my case, I can probably use them interchangeably.
Right.
But they're certainly not necessarily interchangeable words.
So would you say that for public health? Would you say that for public health, you absolutely need to have an extra qualification, such as a master's in public health, whereas for global health, you don't necessarily need to have extra qualifications? So I think this is actually the most commonly asked questions amongst physicians.
Yeah.
How to break into the field? Is master's in public health kind of the door to this field, or are there any shortcuts? Just because somebody is a clinician, could they take a shortcut somehow?
Yeah, I mean, unlike medicine, there's no clear-cut answers in public health and the real world, I think. There are some treadmills you can jump onto and you follow a program and you finish with something at the other end. But I'd say it's a bit less clear-cut. So I think it's easier as a relative term to move into public health if you have a qualification, but it's certainly not required. So, if you get a master's in public health, or it doesn't even have to be public health. My master's is in health policy planning and financing, which is not pure public health. It's one of the branches of public health. Even if you do something a little bit different, maybe even a distance master's, which you can do in your spare time over 2 or 3 years, or a diploma or a certificate, anything that shows your commitment and shows that you have an understanding of that work is valuable if you're looking for a job in public health. For example, someone who's a clinician in maternal child health, if they want to do communications work in maternal child health in a developing low and middle income country, for example, they probably don't need a full public health degree.
Right.
They could just do a diploma in health communication, and that combined with their clinical knowledge in maternal and child health would make them a very good candidate. Similarly, if you want to do clinical research that allows you to partner with other people in your team who are public health people, then again, a bit like I did at the beginning, that's another way in, I guess, into public health without necessarily getting another qualification. The other way to do it, I think, as well, which is not a quick fix, but is an opportunity, is a way of doing it. It's to slowly break into it over time, doing it, as a part-time thing on the side of your clinical work, working with your hospital managers, for example, or working with the local health authority to help them with some planning or design work. And then over time, you build the exposure and the experience to the point where in 5 years' time, you can say you've got 5 years worth of experience and exposure that you can then find another job somewhere else that's related.
Yeah. But how would you generate these opportunities? You just mentioned that, you could even work with your local hospital management team on some projects. How would one even find out about what projects are available? I know it sounds probably to you quite straightforward, but actually many doctors feel stuck and don't know exactly how to find these opportunities to show commitment.
I mean, again, it's a bit different to medicine in that, the jobs aren't always advertised. It's not that there's once or twice a year there's a rota of jobs and you kind of look through the list and apply for them. Sometimes it is just about asking around, finding out who's in charge, and just telling them, look, I don't have the right experience, but I'm interested. Even if it's just to help out on a project, a bit of data analysis or collecting data even, or supporting with an audit, or depending on your working environment, you might have the opportunity to take a study week or something. And instead of using that week to go on a 1-week conference to work out how to do a procedure, you can spend a week shadowing someone in your local public health authority or in the local hospital management team or something like that.
Right.
So you do need to be a bit proactive. But as I was saying before, you only have to be lucky once to get your foot in the door and to meet the right person who gives you an opportunity. So you put out the feelers and see what comes your way.
Yeah.
I think you just have to persevere a little bit sometimes.
Yeah. And, obviously master's degrees are quite expensive. So before somebody makes a commitment to that, or even just a diplomas are also can be quite expensive and time consuming. How would one decide exactly what qualification they need? It's almost like doing reverse engineering, right? So they would need to first understand what field they're interested in, but how would they know that? So what comes first and what comes afterwards?
I mean, often you don't know what field you're interested in until you try it. So it's a bit like medicine in many ways. I applied to medical school not knowing what being a doctor is like. You give it a go and you realize it's not for you, so you try something else. I mean, so I think there were two questions in there. The first one was sort of funding opportunities, I think, and the second one was how do you pick your specialty. The first part, I think there's no rush to study something if you really don't know what you want to do. And you may have the opportunity to work for a company in a project management position or as a clinical advisor or something like that. And the company may even sponsor you to do a diploma or a master's. If they see potential in you, they may even fund it for you. There are ways to do it part-time. There are executive masters. There are part-time masters that you can do in your spare time over 2 or 3 years, as I mentioned. And those are ways of still having a job and studying at the same time. Arguably, you lose a little bit of the networking opportunity, but it allows you to earn income while you're collecting the qualifications and the networks and the learning. In the UK, at least, there's also the public health training program as a clinician. So instead of doing core medical training or core surgical training, you can actually apply to be a public health trainee. I can't remember, it's 5 or 6 years. Mm-hmm. They take you down a certain route. It includes a master's in the middle of it.
Right.
So that's paid for as part of your training. So, so there are other ways around funding additional qualifications. The next part was, how do you choose your specialty? I guess there's no rush. You don't have to jump in and pick a specialty straight away. I tried a few different things, some of which I didn't like. Working for this charity in India, it was a great experience, but I wasn't sure if that was a career aspiration for me. It was fun. I learned a lot, good experience. Again, working in Thailand, exposure to this kind of sort of think tank academia kind of work. Interesting, enjoyed the experience, but wasn't necessarily for me. You try things and you work out what you like and what you don't like. And actually having those experiences helped me in later life as well, because I can now draw on those experiences in my professional job to say, oh, well, I used to work for an organization like this one or like that one. I know what they're thinking. I know some of their budgetary constraints and why they can or can't do something. And so it gives you a few different perspectives.
Yeah.
So it's all useful. I don't have any regrets. Even some of the wrong turnings I took along the way, they've all sort of added value to me at some point.
Yeah.
In the next chapter of whatever it is that I've done.
Absolutely.
You asked earlier a question, how did I end up in global health security? Was it planned? I don't think I even finished the story of my journey, but it certainly wasn't my plan to do global health security. I did my master's in health policy, planning and financing, and although I was interested in infectious diseases and working overseas, I didn't know global health security was going to become such a big thing and that my career would lead me down that route. And in fact, my first my first few jobs, all with the same company, my first few roles, I should say, were more about health economics and digital health and working on a few different bits and pieces, more as a general health systems consultant than anything to do with health security. And it's just in the last sort of 3-4 years or so that I've really got involved in this world. So yeah, it wasn't planned. It just it was a combination of experiences and training and etc. that sort of, and networks even, that sort of bring you, that help you gravitate towards one role or another.
Yeah.
So here I am now.
And would you say that for a medic, there are particular options in public health that are especially relevant? And in opposite, which parts of public health medics should absolutely avoid for whatever reason? Or maybe medical degrees looked unfavorably somehow.
Yeah, I mean, it's how you play your cards. I mean, I don't think there's anything you need to avoid completely. A lot of it will depend on your interests and what opportunities come your way. I think some jobs are a bit more relevant than others because it adds a little bit.
Like what?
Helps with the understanding. So, I mean, I can't speak for everything, but based on my experience, you know, if you want to move into sort of public health and health informatics and health IT systems, then having been a hospital clinician working on the front line, playing with computer systems, whether as a GP or in the hospital, and you know, being part of that world, puts you at a big advantage over someone who's never worked in as a clinician or on the front line of healthcare. That's quite a generic example, but other ones like maternal child health, infectious diseases, especially now, you know, with COVID-19 and health security really being a sort of an in vogue topic, having some experience of infectious diseases, understanding how doctors think, understanding about infection prevention and control, although you can come at them from a public health angle, having that on the ground experience also adds a little bit extra. And you know, the last example I'll give, which is I think probably more relevant to some of the work that I do in low and middle income countries, is having a medical degree in some countries, rightly or wrongly, when you're in front of certain decision makers who are also medical doctors, it gives you an extra connection. Yes. You speak the same language, you've been through the same experiences, you've learned the same things at medical school.
Yes, exactly.
So even if it doesn't help you do the job, it helps with the connecting with people and understanding what they're thinking.
Yeah. All right. And, you know, there will be some viewers here who would like to build a portfolio career and may not necessarily want to leave clinical practice completely. Are there any opportunities or any sectors within public health that are particularly suitable for this, where somebody could perhaps somehow do consulting or something else while keeping clinical practice going as well? I think there are. I mean, consulting is a good example. Consulting tends to be sort of ad hoc kind of work, depending on what's being commissioned. It can be a bit harder to predict with consulting because you don't always know when the next opportunity might be on the horizon. It's very demand driven. So, you know, if people don't need your help in that particular thing, it can be quite hard to predict. Yeah. I think things like academia, so research, paid through a university with funding from the National Institute of Health or some kind of philanthropic organization, or even a pharmaceutical organization with an interest in a certain area, that can be a bit more flexible, I think, and it can allow you to sort of dabble in a bit of clinical and public health. Teaching, I imagine, is quite it can be quite predictable, and I don't necessarily mean local teaching. I mean sort of if you want to go overseas and teach, the gold standard treatment in the UK in a, say, middle income country, there are some organizations that provide opportunities for that. There are charities NGOs who sometimes recruit clinicians. There's volunteer organizations too, VSO, and in America there's Peace Corps, which is a bit longer, but I believe they take on some medics as well. What is it called?
Médecins Sans Frontières. Peace Corps.
Peace Corps.
That's an American. Okay. Peace as in PEACE, and Corps as in CORPS. So that's for a couple of years. It's similar to VSO, which is the UK, I guess, equivalent. But there are opportunities to sort of do delivery work as a clinician in other countries that allow you to work mainly as a clinician, but so I guess that would count potentially as global health or international health. But often in other settings, you'll work out quickly that the systems don't make sense, and you'll start to dabble in management, and you'll start to dabble in policy, and you end up getting a bit of experience in public health through that as well. So I think probably those are the most flexible. I'd say if you don't want to throw yourself in 100%, try something completely different.
So you were a consultant for WHO. How would one land such an opportunity, even if it's with a different organization? Do organizations just headhunt you, or would you actively seek out those opportunities yourself, again through networking? How did it happen for you, and how do you know others making those consultancy opportunities happen for them?
Yeah, so I mean, there's consultancy for WHO and there's consultancy in general. I think it's probably easier if I answer them a bit separately. So, I mean, my experience, I was quite lucky. I was contracting at the time for the company I work for now, but one of their subsidiaries, and they won a contract with WHO, and so through that, I was put forward as a consultant to help WHO in South Africa at the time do some modelling work over a number of months. It was sort of a health economics, health organisational governance piece. So that's how I got that one, and there was a bit of luck there. I certainly didn't. It wasn't something I applied for that was online or anything. There are opportunities to work as a consultant for WHO. They can be quite hard to get. People's experiences differ. They've got an online portal, you register. A lot of it requires you to have qualifications and experience, and knowing one or two people also may help you get those opportunities. So they're a little bit harder, I'd say, in general. Unless you're a real world expert in something and they need an expert in, say, polio, and you are an expert in polio as a clinician, then it makes it a bit easier to get in that way. But I think consulting in general, working for consulting firms who in turn might do consulting jobs with WHO or the UN or the World Bank or African Development Bank or whoever, I think, again, it's a bit of networking, but you kind of go online, find out who are the main players in that area that you're interested in, if it's health communication, if it's policy, if it's clinical research, and you send them emails and see what happens. Some of them will have online databases that you can apply formally, and you go on the database, and if the right opportunity comes up, you get a notification to say, can you send us your CV? I should probably add, that's how I got my first consulting job with the company I work for now. So I'm now a staff member, but when I started out, I was a consultant, just doing rolling contracts,
So you just sent a CV? Did you send a CV and said, let me know whichever role will be suitable for me based on my CV?
Yeah, so I actually emailed a number of organisations while I was doing my master's. In fact, I found out about this organisation that I work for now during my master's. They came and did a careers talk at the London School of Hygiene and Tropical Medicine. They weren't the only people I emailed, but I sent my CV and I said, I looked at your website, you look really interesting. I saw there's a database. How do I get on the database, and do I have enough experience? I used to be a clinician, but I'm looking to transition. I've now got some skills. I need to do a master's project. I'm looking to do something in health economics. If you know anything that might be on the horizon, let me know. Next thing I knew, they didn't reply straight away, but I think, I can't remember if it was weeks or months. It might have even been more than a month. I didn't hear anything from them, and I sent a follow-up email, and they emailed back to say, yeah, come in for a coffee.
Okay.
So I went in for a coffee, and then after that they called to say, we've got some interesting work you could potentially do in South Africa. So that was it. That was the beginning. I signed contracts, sent them my passport, they booked the flights, and and that was my first sort of paid consulting job in health economics.
And do you think you would have got that if you didn't have the qualification?
I suspect not. I suspect the reason they took a chance was I was a clinician. I'd taken a year out and tried a few different things.
Okay.
I'd been, one of my or a couple of my modules on my master's were in analytical decision making, economic modeling, economic evaluation. Those were some of my modules, and so I think they knew coming out of the master's I would have a skill set that not everyone would have, and certainly not something you learn in medical school.
Yeah. And
although I hadn't tested it in a real life setting, in some ways it made me cheaper than someone who was a bit more experienced.
Yeah.
But also it wasn't super high risk that they were trying their luck with someone who's never done anything before. In fact, my master's dissertation was a health economics modeling type project. So, so I think in that case, I probably, it was a combination of all of the above, essentially.
Yeah. And, this actually reminded me to ask you, is there something that more junior doctors, perhaps straight out of medical school or only having had 2 or 3 years of clinical practice compared to very seasoned clinicians, is there a difference what they should be thinking about, how they would go about breaking into public health, or would you say that a qualification and networking is kind of the solution for all, regardless of their experience in clinical practice?
Personally, I would say it's the same approach for whether you're, I did 3 years of clinical medicine before I left, so I was pretty relatively junior at the time. I try to think of people I know who've done a bit more and left, but I'd say that the approach probably ought to be the same. You might be looking for slightly different roles, you might be looking. You probably don't want to come in right at the beginning if you're more experienced. You might want to come in as it depends on the type of role, but you probably don't want to be the intern, for example, and not earn any money and. You report to everybody and everyone asks you make the coffee, you fix the printer. You probably don't want to do that as someone who's been a doctor for 10 years. But, when you've only been a doctor, newly graduated, 1 or 2 years experience, you take what you can get. And, often those opportunities are what starts off your career. And certainly when I started how old was I? I must have been in my early to mid 20s or so, I took whatever I could. So I know when I tell the story now, looking back over 10 years, it sounds like it was very planned and there's been steady progression. And in hindsight, there has been steady progression, but it certainly wasn't planned at the beginning. I did whatever came my way. So don't be fussy is what I think I'm trying to say.
Okay.
If you're just starting out.
So we've had some other questions from across various platforms, and one of the questions was that somebody would like to have an experience in an NGO, but they don't take anybody without prior experience. So how would one get an experience to get an experience?
Yeah, no, it's a question that comes up a lot, right? You might get lucky, email them and say that you've been a doctor, and although it's not relevant experience, although it's not directly comparable experience, there might be some overlaps and relevance, and you've led a team even though it was on a ward, and you can manage time and take the transferable skills out and say these are things I can do, can have a go. But the alternatives are you offer to do it for free, do it as an internship or as a work experience. Right. Use that as an opportunity to show that you're capable, and then apply, see if there's a job opportunity that comes out of it.
Okay.
It comes down, a lot of it's networking in this world. It's very different to medicine. It's not structured.
They would even apply if there is no job opening. So they would actually write and start kind of saying that, this is my unique selling point. I'm really interested in working for you. Maybe you take me on for free for a few weeks. Something like that?
Yeah, there's not a lot written about this. What's the worst that can happen? They ignore your email, or they write back and say no and point you somewhere else. I personally, if you're looking to try something, I would give it a go. Right. My experience is people are generally quite nice and they want to help you if you show that you're willing. So not everyone will, but as I said before, you only have to get lucky once to get that one experience, and then you can start applying for all sorts of jobs. The other thing, I guess, I sort of mentioned it earlier as well, you could do things on the side of your current job. So, as you're working as a clinician, speak to the hospital planning manager, or I don't know what the title is, but or the local public health authority, and do something on the side to see if you can help them out. Because once you've got that on your CV, you can use that as relevant experience. So it's arguably a bit sneaky, but you kind of have to play the game a little bit as well.
Yes, absolutely.
And the checkboxes.
So the other question was, how can medical graduates that didn't match for residency work in public health field without going back to school? Is it possible?
So that sounds like it's a question from the US. I'm not completely familiar with the US system. So sorry, the question is, can you still do public health without residency?
For residency work in public health, still get into public health without going back to school?
Okay, so I don't know the US system very well, but I imagine you don't need a qualification to engage in public health, at least not in most countries anyway. In some countries in the UK, there is I can't remember what it's called, the Faculty of Public Health, or Royal College of Public Health, that is recognised. But actually, a lot of people work in public health who aren't a member of that, fraternity. So the short answer is yes, you can. I guess the follow-up question is, where do you go? I guess you could look around at university public health faculties and see if they've got anything going that you can help out with. There's the local hospital level or local authority level public health work that's going on
already.
If you're living in the state capital or even Washington DC, there might be some federal stuff that you can get involved in as well. So there's lots of different levels of public health.
And there have been a few questions, both from the US as well as in the UK, whether you can get into public health without a license. Is license mandatory, or are there specific parts of public health where it is mandatory and where it isn't?
Yeah, so this is very country dependent. So I'd encourage you to look up what the local rules are on this. My experience generally for something like public health is you don't need a license. Some jobs might require you to have some kind of membership or to have passed some kind of central exam. I know there are certain jobs in the UK that expect you to have gone through the public health training program. This, I can't remember exactly how many years, 4, 5 or 6 year program. So it depends a little bit, but if you're willing to work in certain bits of public health and you're not that fussy, then you don't need extra qualifications.
Okay, cool. Yeah. Well, thank you so much, Anthony. I think we've covered a lot today, and would you be happy for people watching this to contact you if they had any further questions, maybe on LinkedIn? Yeah, thank you.
Yeah, absolutely. Having just told everyone they need to network, then please do get in touch.
But also for anybody watching this, feel free to join my Facebook group for doctors called Non-Clinical Medics Mastermind. So again, we brainstorm various ideas, including public health, within the group. And also subscribe to my YouTube channel, because I will be posting more information, more videos, possibly even interviews about this field and other options for doctors. Thank you so much, everybody, for joining us today. Thank you, Anthony, again. And have a great evening, everybody. And have a great part of the day that you currently have in your respective country. Bye-bye.